Hello everybody, it's Dr. Galvin with today's coronavirus update. First week of October 2020. We've been dealing with this virus, pretty full time now since February. Where do we stand today? Well, as of today, 35 million cases worldwide, over 1 million deaths here in the US, 7.5 million cases, 213,000 deaths, going up about almost 1,100 deaths daily. That's a lot. My state of North Carolina, 220,000 cases, 3,600 plus deaths so far. Lots of stuff going on in the news. President Trump diagnosed with COVID and apparently has infected its entire circle, or somebody in that circle has infected quite a bit of the White House staff, some of the upper echelons of the Senate as well, people that were in contact with President Trump, whether they got it from him or whoever gave it to Trump, who knows. I don't ever get into politics and I don't share my politics typically, but I do have to say, is this surprising? I mean, we've seen kind of a consistent, lack of respect for the virus and distancing, and the things that we've been telling people all along are going to help prevent you from getting it and giving it to other people. And, this is sort of an example of, well, if we're going to completely ignore all those things, we may end up coming down with it. Why do we worry in particular? Well, obviously it's the president, but, he's also, an elderly gentleman who's obese and puts him in a much higher risk group. He is getting treated kind of with the kitchen sink. He's getting treated with everything. Remdisivir, Dexamethasone. He's getting treated with the Remuran monoclonal antibody cocktail that we've talked about. And, there's a little concern that, either he may be sicker than they're letting on, or he may be a victim of what we call sometimes in medicine VIP syndrome, where you get somebody who's a VIP and the tendency is to throw everything at them. And sometimes that can actually cause harm. The antibody cocktail from Remuran, hasn't been studied in that population. I think the study so far, they've only tested in a couple hundred people, and I think they've all been less than 44 years old, and they haven't been inpatients. They've been treated as outpatients. And so, they're giving an experimental drug that's not even approved for anything to him that hasn't been studied in his population. And I understand if you're his doctors, like, you want to do everything, you don't want to kind of mess up and have something bad happen, but also there could be unintended consequences. We're using experimental treatments that we don't know anything about. By all accounts, it sounds like he's doing better, which is good news. I have to share a little of my own COVID news. I've known quite a few people that have had COVID, either patients or friends or whatever, but my daughter was diagnosed with COVID yesterday. She is up at Appalachian State. She's a senior. She's doing fine. Mild cold symptoms, but it's kind of marched through her house. One of she lives with 3 other girls. One of them got exposed to somebody last Friday and tested positive, I think, on Sunday. And then they basically, my daughter got tested almost every day this week because one by one, every one of her housemates tested positive, and finally she tested positive yesterday. They've all got mild symptoms. One of the girls has lost her taste of smell. They are quarantined. We're sending them Instacart to feed them. They're locked in their house. The Watauga County, where the school is located, is doing an excellent job of contact tracing, and public health has been in touch with those girls every single day. So they're actually doing a really good job. Nobody's particularly sick. So I'm reassured. It's my daughter, but do I think that she's been doing all the things and her friends have been careful? No, they're college students. What do we know about college students? They're not really following the guidelines. They've been, giving lip service to being careful, but I know that they've been, hanging out. They haven't been going to big parties, but they still have been, hanging out and seeing each other. My daughter works at a restaurant. And so is it surprising that she's got it? She's young, she's healthy. Am I worried about it? Right now, they're all doing great, but it didn't surprise me. Here coming from me, telling people to be careful and my own kid. But I understand that that's how college students are. And I'll keep you updated on how she's doing. But all the girls are doing fine. They've got a little playhouse going on, but they're good. One other interesting thing today, CDC finally came out and said something that most physicians and healthcare people have known all along, that yes, COVID can be transmitted airborne. And what that means is in smaller size droplets. typically we talk about these large respiratory droplets. So the virus itself is very small, but it gets, it gets into these big respiratory droplets. And when you cough or sneeze, these large particles that are filled with millions of virus particles kind of go out, and they go out and then they kind of fall. And they don't, that's why we talk about 6 feet, because it's unlikely for those particles to travel more than 6 feet. And that's the primary mode of transmission, and we've known that. But early on, we knew that aerosolization, meaning that you take those particles and instead they get suspended in little tiny droplets that can actually like dust. Like if you're like, you sit in sometimes your living room and the light hits the dust in the air just right. You can see little particles floating around. Well, that's an aerosolized particle, and it's light enough that it kind of float around. And the problem with that is that can travel a good distance beyond 6 feet and potentially even linger in a room. So if someone who is highly infectious coughs or something like that and aerosolizes some droplets, leaves the room, you could conceivably walk in there, unknowingly and get exposed. Now, a mask would help that a little bit. Certainly knowing that the person was there would be helpful, but that mode of transmission in healthcare, we've been worried about it because we aerosolize these particles unintentionally when we're doing certain treatments like intubating people or putting them on a BiPAP machine. And so it's been a big concern in healthcare settings, but a lot of people have been saying all along that there's good evidence that at least some of the time this stuff gets aerosolized. And finally, remember the CDC said it did, and then they backed off. Well, now they've come back out and said it does. Now, what are how are you at risk for that type of transmission? Poorly ventilated, enclosed spaces with lots of talking, heavy breathing, or singing. So what does that mean? Things we've kind of warned about. That would be, small gyms, church services, potentially, restaurants and certainly bars, sporting events, large gatherings of people, like that there's a lot of yelling and things like that. That is going to put people at higher risk of getting, COVID from an aerosolized thing. And so it's that yelling and talking that could potentially aerosolize those particles. And so you've got to be really careful, and you've got to sort of avoid those situations. And that's why churches have gone virtual, and people are doing Peloton and apps and things like that for fitness. Some gyms are fortunate enough that they're big enough. The gym that I work out is massively, it's huge, and they open up all the doors, and I feel it's almost like working out outside because there's so much ventilation in there, and ventilation is key. If you don't have ventilation, it's a problem. But if you have a gym that's the size of my office and there's 12 people working out there, well, that may be a bigger risk. And so I think you need to take that into consideration. I don't think you need to radically change. I think the guidelines, distancing, masking, washing the hands, those are the things that have been shown time and time again to kind of prevent transmission and are the things that are going to protect you. I'm going to call it quits here for the day. I'll be back with some more videos later in the week. If you find this useful, please subscribe and hit the little bell to subscribe and like us on Facebook. We'll be back with more content later on. As usual, wash your hands, wear your mask, look out for yourselves, look out for your families, look out for those around you. Stay safe. We'll talk to you soon.